Good afternoon. I am Natalia Guzman, the CHCI PepsiCo Nutritional Health Graduate Fellow. I'm delighted to be with you today for the Hunger, Nutrition, and Health Let's Get Moving session. As a newly registered dietitian nutritionist, I strongly advocate for community-based initiatives that improve and provide equitable access to nutritious foods to marginalized and food apartheid communities. I firmly believe that ensuring food security and addressing its components, its determinants, and other systems that play a role in a community's health, like socioeconomic and environmental factors, should be the primary focus of nutritional health. On behalf of CHCI, I would like to thank our moderator, our distinguished guest, and all of you for joining this session. It is now my pleasure to introduce today's moderator, Alejandra Jep. Alejandra Jep is a Senior Director for Health Programs at Unidos US. Ms. Jep leads the strategy, development, and evaluation of food insecurity programming aimed to advance health equity. Ms. Jep has expertise in developing and implementing health programs that advance the health and well-being of Latinos and Unidos US priorities and values around equity and equality. Please welcome Alejandra Jep.
Buenas tardes. Thank you, Natalia, for kicking us today and welcoming us to this session. We've been looking forward to be here today and to share important information about programs we are currently implementing in both the public and private sector. And thank you to CHCI for hosting this health summit and focusing attention on how public and private sectors can work together to build stronger and healthier Latino communities, especially as it relates to hunger, nutrition, and health. As many of you know, the U.S. is a land of plenty and the world's biggest individual exporter of food. Yet, 34 million, and I'm going to repeat, 34 million people, including 9 million children, are food insecure. The most recent data from the Census Bureau, dated March 2023, showed that Latino households with children sometimes or often did not have enough food to eat in the last week, at double the rate of white households with children. Food insecurity, without a doubt, is a threat to the health and well-being of Latinos, and consider another public health crisis given the limited access to healthy and affordable food. Today, to discuss this successful program I mentioned earlier that aim to address hunger and food insecurity in this country, I'm delighted to be joined by 3 experts on this topic, and each of them will introduce themselves. We are going to start with Alberto Gonzalez. He is a senior advisor for external engagement, food and nutrition service with USDA.
Thank you so much, Alejandro. Buenas tardes. Well, thank you for all being here today. I'm honored to be here with my esteemed panelists and with Alejandra also. So my name is Alberto Gonzalez. I'm a senior advisor for external engagement at the USDA's Food and Nutrition Service, or FNS for short. We are the agency that administers a suite of more than 16 federal nutrition assistance programs, including WIC, school meals, and SNAP. So very thrilled to be here with all of you today. And I know that for me, this is an important role to be in, coming from a family that participated in these programs. So lived experience is something that shapes the policies that we work to advance. And I'm also excited to be here with all of you to talk about the work that we're doing to advance food and nutrition security, which ties in with our work to advance health equity, which is very relevant to today's conversation. So again, I'm very excited to be here with all of you today to talk about the work that we're doing across sectors, across different agencies as well. And I will turn it over back to Alejandra.
Thank you, Alberto. Next, I want to welcome Monica Gonzalez, with whom I have worked for a number of years. She is the director for congressional relations with Feeding America.
Great. Thank you so much. It's such a pleasure to be here. Feeding America is comprised of over 200 food banks across the country. We distribute billions of food a year to many families who are in need, who participate in the SNAP program, but also to families who are just above the income threshold for SNAP. So many families who are just struggling to make ends meet. At the same time, we're also the first ones in. We're there during the natural disasters, and we're the last ones out. So any time that you are hearing or seeing about a natural disaster, I assure you our food bank is already there, and they've already been thinking about it. Also, I just want to give a shout out to PepsiCo for their partnership in the way that we do respond to natural disasters. It doesn't happen by ourselves. We work with so many different corporate partners who really do help us. I also want to give a thanks to Bank of America in terms of their support of one of our local capital area food banks. And so I think, again, it doesn't happen by ourselves. It happens with everyone. So thank you.
Thank you, Monica. Finally, but not least, Dr. Veronica Bella. She is a scholar in residence with American University. Welcome.
Thank you. Well, thank you all for being here today. It's so exciting to see a group of people who are passionate about this topic, and I think we're going to have great conversations. My background is really in redesigning how we deliver healthcare systems. I fell into work looking at social determinants of health while I was at Johns Hopkins, and we were looking for ways to address some of the health equity and health disparity issues. And currently, right now, I'm working on projects that are looking at how do we help create a more equitable and nutritious food system. How do we close that gap? Because we know that we've had issues for such a long time. And I'm actually currently working on local and regional issues. So I'll be able to share some really practical things that are happening right now to innovate in this space.
Thank you, Dr. Bella. To all of you, feel free to tweet about today's session. Your comments and follow the discussion on social media using the hashtag CHCI Summit. So now, without further ado, we are going to be ready to start. During her remarks, Natalia mentioned that she had recently become a registered dietitian. As someone who have worked implementing culturally relevant and linguistically appropriate health programs, I have to tell you that to land a fully bilingual and bicultural person in this country is not an easy task. So welcome, Natalia, and I'm so excited that maybe in a close future we are going to be working together. During my remarks, I mentioned that food insecurity, unfortunately, is a reality. For Latinos, about 17% of Latinos living in this country are food insecure. During the pandemic, this rate went up. Also during this time, meaning the pandemic, some challenges that were already in place intensify, including how Latinos were accessing food or were not accessing food. So I'm going to start by posing the question to my fellow panelists with barriers that exist when we talk about hunger, nutrition, and health. And giving you an introduction, Dr. Bella, why don't we start with you?
Yeah, so I mean, I think this issue has been around for a really long time. When we go back to looking at how cities were formed and organizing, the policies that were implemented, redlining, and everything that is associated with that really set the landscape for cutting communities off of resources. And so this is something that is very intentional, right? And so all of this work that we're doing to increase food access, to create, to bring food banks into communities, to try to bring grocery stores into community, it's undoing work that has been around for a long time. So for example, here in Washington, D.C., in Ward 7 and 8, there are 160,000 people, and right now there are only 3 grocery stores there. You go to a different ward, and there's 10, 11, 12 grocery stores. We've had mayors who've come from Ward 7 and 8, and still we have that huge gap, right? And so this is like one example, and it's stamped across all of our cities. So this is some of the legacy that is causing some of this. And of course, our Latino communities, right? We're immigrants. We go in places where we can afford. We're coming into some of these communities where those disparities were there before we even got there. And they're kind of continuing. And in some cases, during the pandemic, it really were exacerbated.
Absolutely. Maybe this question is for Monica. What do we mean, or how do we define a food insecure household?
I think there are many ways. I think the definition, the more proper definition, and I'll look to Alberto to correct me on this, is that we look at households that just don't have enough to eat. They're not getting the full nutrition that they really should be consuming at a particular meal. So we find with households that are food insecure, especially that includes young children, is that you will find that families will begin to ration their food. They'll eat smaller portions of their food. They'll skip meals. We also find for adolescents who have younger siblings, they will often skip meals, and they will sometimes either ration their food, but that has detrimental impacts on them. It leads to suicidal ideation. It leads to depression for those adolescents. It means that they're not able to thrive. They're not focusing on learning in school. They're focusing on their empty stomach, and they're dealing with the stress of wondering where their next meal will come from. So when we talk about food insecurity among the Latino community, we're talking about children and families that are figuring out how to portion out food. And oftentimes there's somebody in that household who is going to bed hungry. Has detrimental impacts because it also means that from a health perspective, they're not thriving. It leads to other chronic conditions because they're consuming empty calories. That means that they're not getting the full nutrition that they need to be able to be healthy, to learn, and to do well going forward.
Thank you. Anything you want to add, Alberto?
Yeah, well, first, I failed to mention early on that I'm a CHCI alum also. 2005. But just to build on the conversation, well, one, COVID really exacerbated the situation for Latinos. We know that the life expectancy for Latinos went down by about 3 years. We know that it revealed a lot of other inequities in terms of the digital divide, in terms of health disparities as well. And I think it's because of that experience that really motivated first, the Biden administration to really have equity be front and center, that it guides every action that we do across all the departments, including the U.S. Department of Agriculture. And so part of that work also inspired us to launch a new initiative called Food and Nutrition Security, which was announced last March of 2022, really to build on our longstanding work to address food insecurity for a few decades. And when we say nutrition security, we mean people that have access to consistent access to equitable, nutritious, safe, healthy food that's essential for optimal health and well-being. So it's really focused on the connections with equity, advancing and recognizing that people out there are not eating, but have a hard time accessing and eating healthy foods, which is why for more than a year now, we've talked to more than 150 organizations, including healthcare players, health insurance plans, hospital systems, to make clear the connection between health and nutrition. And this really inspired the work to kick off the White House Conference on Hunger, Nutrition, and Health, and ultimately our continued engagement with healthcare players across the country to really make clear the connection, so that we could identify innovative solutions to address these longstanding disparities in our communities.
Thank you, Alberto. Monica earlier mentioned about the work she's been doing with Feeding America. So I want to center the following questions around access, and I'm going to start with the critical role food banks and food pantries played during the pandemic, but also currently are playing. In one of the data points I mentioned earlier, unfortunately, food insecurity has increased. So tell us about the critical role they are playing, how Feeding America is going about, and what all of us can do to support food banks and food pantries.
Great. So I first need to set a little bit more context and say that, at the time that the pandemic hit, we were also dealing with the public charge rule that was creating a lot of confusion within the community and having a chilling effect on the Latino community, and they were disenrolling. So families who were actually eligible for these programs were disenrolling out of fear. So not only did we have the pandemic, we also had a very harmful policy that was creating confusion within the community, and that meant that Latinos during the pandemic were not seeking programs and services that they were eligible to receive. And that is why we had to work with a lot of partners, a lot of affiliates with the Unidos organization to make sure that we were meeting the needs of Latinos in a way that they felt safe to be able to receive that food and seek that help. I think the other piece to keep in mind is that, and I want to share a text that we got today from one of our food banks in West Texas, where she shared that more than 25% of the families that she's serving are now immigrant families who are asylum seekers. So not only are we serving families who are on SNAP or serving families who are hitting a difficult time, we also serve immigrant families who have no other way of getting food and nutrition. So we play a very vital role in communities. I think what the pandemic did was really disrupt everything. And it was a disruption for Feeding America as well, and it was an opportunity for us to reflect and say, what can we do better? Where do we need to make improvements? So we looked inward at Feeding America too. So we actually have partner agreements that really help our food banks to say, what does your community assessment look like? Are you in a good place to actually meet the needs of the communities that you're serving there? Also, too, we have our SNAP enrollment. We have over 170 food banks who are now participating in helping families to enroll in SNAP. We're doing it through in-language efforts, resources, obtaining the right language resources for families. We're taking a look at and recognizing culturally that, what works in Los Angeles with the Mexican community may not work in Florida with the Venezuelan community or the Cuban community or the Puerto Rican community. We have to be adaptable and work with people on the ground to make sure that we're meeting the needs of the community on the ground. In addition to that, we're also internally, we have equity metrics. And we also have a board member and a few more board members who reflect the community. We have Anna Alonso, who sits on our board. We have a great number of leaders within the organization who sit around the table when decisions are being made. So that's also incredibly helpful when you're really trying to meet the needs of the second largest population that is food insecure.
Without a doubt, working in close partnership with organizations is very important. I lead the Comprando Rico y Sano program for Unidos US that aims to reduce hunger and food insecurity. During the pandemic, not only was a very difficult time, but also the critical role these trusted messengers played in community was super important. It was equally important to work with partners like Feeding America and others, including USDA. So, Monica, you mentioned about changes Feeding America has introduced. Alberto, as we think of the role USDA plays and where health equity is vital to the functioning of the organization, can you talk a little bit about programs you had in the past, changes you have made?
Certainly. So I will, one program, well, first of all, one thing that came out of the White House Conference on Hunger, Nutrition, and Health is that it really catalyzed a whole conversation about the connections between health and nutrition. But it also, at the timing of the conference, the White House released a national strategy on hunger, nutrition, and health that has a plan in place to end hunger and reduce diet-related disparities by 2030. And this is a whole society approach, really. It involves the federal government, it involves partners, it involves the private sector. More than $8 billion in non-federal commitments were made to advance the national strategy. But in the national strategy, one of the actions that we've committed to doing is to really uplift our suite of nutrition assistance programs like WIC, school meals, SNAP. And I'll just talk about WIC because it plays an important role for Latinos. About 40% of those that participate in WIC are Latinos. And we've made incredible investments, thanks to Congress, really leveraging those resources to modernize the program so that it's easier for those that are eligible to apply and to access these services. And as Alejandra mentioned, an outreach initiative, a public health outreach campaign to reach all those eligible across the country. 1 in 2 that are eligible for WIC are not signed up for the program, so we have a lot of work to do, and we know that trusted messengers are so key to do so. But I do want to uplift a few things that we're doing and that we have done. One, currently we released a proposed rule to reduce barriers to WIC online ordering. So if you're interested, we could send some information your way, but you could go to our website and submit a comment. We know that online purchasing for WIC reduces some barriers for folks. We are also looking to update our school meal nutrition standards. They haven't been updated in a while. So we are asking for your input at this time to ensure that this process reflects the voices of different stakeholders. We've also been working to, as Monica mentioned, really raise awareness about the final public charge rule. We actually hosted a series of engagements with partners in collaboration with USCIS, with the Department of Education, with the White House, to raise awareness about the status of the public charge rule and to clarify what does that mean. And lastly, I'll just mention that when it comes to mixed immigrant status families, that's an important population for us. We've been working to engage organizations. I actually just had a call with a USCIS community liaison based in Nevada who works closely with their school district there. And she mentioned parents were so confused about their immigration status and whether they could sign up for certain programs. So we were planning to work together to ensure that all the families in those in school districts like those in Clark County are made aware about our suite of programs in which they're eligible for.
Thank you, Alberto. You mentioned the President's national strategy on hunger, nutrition, and health. The first one in 50 years. It only took us 50 years. The important thing that is here, how do we or can track progress? And Monica spoke earlier about some of the changes Feeding America has been leading or embracing. How do we track progress or formal evaluation for this work?
Yes, so I think one is continue to be engaged in the process. As I mentioned, there's a number of federal rulemaking opportunities where stakeholders can be engaged, whether it's submitting comments. There's ongoing stakeholder engagements for different partners to keep track of the conference goals. The White House just renewed their push to secure additional commitments. This is the White House Challenge to End Hunger and Build Healthy Communities. There's a toolkit on the website for local leaders to take action, local actions to help advance the goals of the national strategy. But I will say that, one thing that we're doing is to continue to implement the national strategy and to uplift how our programs, again, are just so vital to advancing health equity and reducing, diet-related disparities. We've been, I should mention that last year, the USDA hosted a national healthcare summit and to bring together various players in the healthcare system and our partners as well to really have this conversation about the connection between nutrition and health. And, we know diabetes, I have a lot of my family members are diabetic, and so it's very personal to me, but we know that a lot more work is needed to address these disparities. There are some exciting models out there that I wanted to uplift. Another program we have is the Gus Schumacher Nutrition Incentive Program, GUSNIP. If you haven't heard about it, I encourage you to check it out. It was created in the 2018 Farm Bill. I had the opportunity to meet with a sub-grantee of this program in Connecticut that's working to provide or working on a produce prescription program directed to Latina moms. And so there's just a lot of exciting work to connect the food system with the healthcare system. And I think that's just one example of how we're leveraging our programs to build on the progress around the White House conference.
Excellent, thank you. So talking about the intersection between food and healthcare, Dr. Vela, food as medicine. Also known as food is medicine, and Alberto mentioned that a number of his family members have developed or are managing their diabetes. Food is medicine sits at the crossroad of nutrition and healthcare. It may take many forms, including medically tailored meals, medically tailored groceries, and produce prescription programs. How have you seen, or how do you foresee that Latinos can benefit from the effort?
Yeah, that's a great question. I think there's a lot of exciting new programs that are coming about as this movement, the food is medicine movement, becomes more popular and more mainstream. Here within DC, we actually have a program called Produce Plus, where patients can get actually what you've said, right? Prescriptions for groceries, and they can take it to their local giant food and use that to pay for groceries. So I think that's really awesome. I think one of the opportunities we have is that those programs really aren't scaled to the needs to the degree that we need it. So for example, the program that we have that's sponsored by the DC government is available to patients who have prediabetes, live in Washington, D.C., are on Medicaid. However, it's only available through certain clinics. And those aren't necessarily clinics that our Latinos are going to because they aren't necessarily ones known for providing care in their language, right? So I actually sit on the board of La Clínica del Pueblo, which is here in Washington, D.C. We don't have that program. So if there is a patient that wanted to participate in that, we're not part of the system. So I think that there's an opportunity because there's a lot of promise with this work, but then there's still the gap of scaling it so that it's benefiting our own communities.
Thank you. Can we talk a little bit about the challenges and risk factors? There are a lot of disparities, and food is medicine, is far away from reaching, especially low-income Latinos. What are some of the challenges, Monica or Alberto?
I think, one of the things that we're doing at Feeding America is that we have a dashboard where we're looking at the not racist, but racism and systemic barriers towards that drive food insecurity. So we can't just continue to talk about creating access. We have to look at all the things that actually drive food insecurity. So it's poverty, disability, home ownership. Those are drivers, and going deeper into those drivers and looking at the disparities within those drivers. So once we recognize that, we're also able to really come together and figure out the right policy solutions, the right design that is really going to meet the needs of people who are food insecure. At Feeding America, we have been dealing with maybe not technically the Food is Medicine program, but we do help people who are medically fragile, and those tend to be older Americans. We have the CSFP program where we're distributing food to them. In our partnership with DoorDash, we've been able to expand and reach more older Americans in terms of being able to provide food boxes that will help them. And also providing nutritious meals and boxes where they can make meals that will support their recovery if they've been released from the hospital or they have continuing chronic conditions. So there are many ways in which we're really trying to meet the needs of everyone, but it's really important that we also look at the root causes as well to make sure that we're meeting the need. Through our SNAP enrollment, we're working with Google on GSNAP, where basically, because I think we recognize that within our community there are cultural barriers. We have to overcome the stigma. And so I think, people can food search food assistance in Google, and immediately one of our food banks will come up. And it takes them directly to the application. And so they're not having to feel like, I looked for a food bank. What food bank do I look for? Where do I get the application? We're able to optimize that search and connect them to the food bank in their local area with the right application to help them get that get the resources that they need. So there's lots of ways in which we're really trying to make sure that we're creating access. And also in the SNAP enrollment work that we're doing, we have many SNAP navigators at food banks and food pantries to make sure that we're helping them connect to the services, to the supports that they need and that they're eligible to receive.
I'd love to follow up on something that Monica said that I think is so critical. When we think about the drivers of food insecurity, right, we know that income is a major driver. And one of the things that I am, in my own reflections recently and my own work around our food system here in DC, we are so, our community plays a huge role so that all of us had food on the table. From the migrant farm workers to the people who are preparing meals in the backs of kitchens. And I think that there is a huge opportunity for us to move beyond people that are in the back scene supporting the creation of our food system to actually leading that. If we know how to farm it, we know how to pick it, we know how to prepare it. What's stopping us from owning businesses that actually strengthen the food system within our community? I would like to see policy around that, supporting food entrepreneurship so that we have leaders who are increasing the availability and the affordability, the accessibility of food in our own community. I think we need to move beyond just providing food as a supplement. We need to think about how are we actually changing people's economic situations and bringing food. So that's one comment I think around how do we do something that's longer lasting. And I'd love to charge all of you to think about what kind of role can you play to help, support entrepreneurs in your work as leaders of organizations, in your work doing advocacy. Where is there room for us to really push the envelope so we're owning our own food systems instead of just playing a part of the existing infrastructure?
Thank you. That is an excellent point. We see that farm workers live in poor condition generation after generation. So the question we all have to ask ourselves is, why is that? I mentioned earlier, this is the land of plenty. What does it mean? Do I care to pay the $2 for my broccoli? But what is behind that? So certainly, all of us have a role to play in how people who produce, who work our farms are paid and compensated. Mm-hmm.
Really good point, because we're in the middle of the Farm Bill conversation, and we're seeing some harmful provisions being added as part of the debt ceiling negotiations, work requirements. And so, for Feeding America, it's not about adding and layering existing programs, because there is an existing work program within SNAP with other administrative burdensome requirements. It's really about how do we invest in work that creates that pathway out of poverty, that provides the kinds of supports that helps people, childcare, reliable transportation, jobs that allow for sustainable employment and to move up the ladder. And so I think, when we see this whole conversation taking place and the vote that's going to happen tomorrow, we have to think about what impact does that have later on. Are we really designing and creating policies that keep people from accessing the programs? Or are we actually creating access and removing those administrative barriers so that people can have the nutrition they need, so that they can work and not be wondering where their next meal comes from? So I think, you're right. We need to look at how we are making policy in a way that is incentivizing the kind of outcomes that we want to see.
If I could just build on that, to what Monica said, I think there's other important policies out there that this administration has prioritized and proposed around the minimum wage, raising the minimum wage, child tax credit, really making it easier for families to support themselves. And our programs are for those who need it the most. They're temporary programs to help address food insecurity. The one thing I wanted to also raise awareness in this room about is the end of the public health emergency, because that's also going to make some changes with respect to Medicaid, but also with respect to programs like SNAP. And so we've been working with our state agencies for more than a year now to prepare for this transition. And we had this authority granted to us by Congress, but this is because of the announcement of the end of the public health emergency. It's contributing, or it's going to lead to the unwinding of certain flexibilities. But I think it's going to really elevate the critical importance to examine these policies like raising the minimum wage, child tax credit, bolstering health coverage for more folks out there will be crucial to help the families that we reach every day.
Thank you, Alberto. Monica mentioned earlier application to access to some of the programs. We saw during the pandemic that many Latinos don't know how to use technology, nor they interacted with an app. Most of us were just forced to embrace the technology. What changes has the USDA inserted since to make technology more accessible?
Well, I think COVID really changed all of our lives, and I think it's allowed us to test different approaches that we couldn't do before. I think now, one thing that came out of COVID is online purchasing on SNAP. A lot more states are able to leverage this tool. But I think it also, as I mentioned earlier, provided us with an opportunity to work to modernize WIC, which is something that's a priority for us to make sure that we are making it easier. We have an executive order actually from the president to reduce burdens for folks that are eligible for our programs to have to go through in order to access our program. So it's a it's a administrative priority. And I do want to uplift some existing resources we have. We do have grants for states to help improve in their processes. And one thing that we leverage in those types of programs is really the importance of working with community-based organizations to get the word out about programs, and who are trusted messengers to ensure all those that are eligible sign up for our programs. We issued a series of waivers during the public health emergency, and we're continuing to work with state agencies to help work with these through this transition. But I would say that the other program I wanted to uplift also is the Affordable Connectivity Program, ACP. So folks that are eligible for WIC or school meals are able to get a discount on internet access and equipment. 17 million people have signed up for this program, and so it's another resource for families out there who need it the most.
Thank you. With the minute I have left, Dr. Bella, earlier you did a little call for action. What can each of us do to be more engaged on this issue? What are the two key drivers?
Oh, that's a great question. I mean, I would say first and foremost, look within your own community and look at what are the disparities that you see. For those of you who live in Washington, D.C., I was sharing with Gabe last night about a problem that I recently came about, which is the fact that in Ward 4, which is where I live, which we have a large Latino community, there's only one farmer's market. In other wards, there are 10, 11 farmers markets. Why do we only have one farmers market? But you can go on the DC Food Policy website and it'll show you exactly how to start a farmers market, right? So this is where I want our people to come forward. Let's be part of the solutions. Let's look at the gaps in our own community, and instead of waiting for the answer, we can of course take advantage of existing programs, but we know that getting food on the table is like a today issue. It's not a when this policy then gets funded and it comes down. That's all great, and I'm glad that there's this broad change, but if we really want to see change in our daily lives with our communities, we got to look and see what are the problems and how can I be part of a solution. So I would say look locally, figure out what the gaps are, see if there's opportunities for you to step up and play a role in that, or do you work with an organization that is interested in helping close the gap? How can that organization help facilitate movements in that area?
Monica or Alberto, something you would like to add?
I just want to say that I felt like the biggest thing that happened at the end of last year was language that allowed for non-congregate feeding and summer ABT to go nationwide. That was tremendous and really opened up the floodgates, especially for Latino children, to have access to the summer meals program. Previously, it was a program that only really got an F. It was only reached 18% of eligible kids who were on free and reduced price meals. This was monumental. I think they called me Monica non-congregate in my office because it was the most important thing to me to know that kids who were afraid to show up somewhere and stay all day, parents who were afraid to have their children show up someplace and stay all day at a summer program could have meals. We could meet kids where they were, whether it was a bus stop, whether it was in particular housing communities, whether it was in a community center, a library, somewhere. We could meet kids where they were. And for me, that was just the biggest win that we could see, especially during the public charge era when, kids were just so afraid to show up anywhere and parents were so afraid to take their kids anywhere. And so the passage of that and making sure that kids would have access to food in the form of the EBT card that comes to their house and they could go buy food in the way that they want in their local community was just huge. The dignity in that, the equity in that, the access in that, to me was just everything I live for in doing this work.
Yeah, I would add on to the points raised about summer EBT as well. It's a critical, powerful tool was made permanent thanks to the act of Congress late last year. And I think it's an opportunity for different stakeholders that serve Latinos to really raise awareness about the program and the benefits of not just summer EBT, but all the nutrition programs and the impact that it has. But I think with respect to summer EBT, making sure that it reaches, it's estimated to reach 29 million kids. And we know that summer feeding and summer programs are essential for the communities that we care deeply about. And so I would love to continue working with all of you so that we can really raise awareness about this new exciting program. It's a new entitlement program, and so we want to make sure that we maximize its reach so that we ensure that all Latino kids during the summer do not go hungry.
Thank you. So we are going to open the session now for questions and answers. Any questions? Yes? The lovely lady in black and green sitting next to Natalia.
Is this on? Okay. Hi, my name is Karina Yanes. I'm the CHCI Google Public Policy Fellow. And I love that you talked about food stamps because those little EBT cards, my sisters got them over the summer and they were so excited. They went to the store to buy hot Cheetos and they were like, they thought they were so cool. But I think that's a great program. And I just keep thinking about why is food commodified? I think studies show that everybody needs to eat. And if you're not healthy, you're not going to survive and be a productive member of society. And I guess I'm just wondering if you see a future where something like SNAP is universal, for everybody, or what kind if you see any advocacy to take away the restrictions, because I know there's if you're drug tested and you're doing drugs, you can't get it, or maybe if you don't have a stable home, but it's you still need to eat, So that's a basic necessity. Do you see any push to make that universal in the future, or do you see it expanding in any way?
SNAP is a means-tested program, and it's really designed to meet the people who need the food the most. So I think, it would not be universal, but in terms of lifting the ban on convicted felons, that is something that Feeding America does support. We believe that in order to allow for people to re-enter into society and to be able to thrive and to be able to be successful, that we should allow them access to food, to nutrition. We're seeing the scourge of fentanyl across the country. And so if we're to make sure that people can be healthy, to be able to thrive, then we need to make sure that we make these programs accessible. It is something that has also become important to Senator Cory Booker and even some Republicans on the other side of the aisle, because they recognize that, with the scourge of fentanyl across the country, these are their constituents who are coming back into society and won't have access to food. But we should absolutely make that hugely important. I think one thing we did not talk about, and I think given the Chair of Public Policy Fellow, is that there is college hunger, and our El Paso Food Bank is going to be releasing a report on college hunger because we recognize, and our food banks do operate pantries in different colleges across the country. For kids who are food insecure, it takes them 7 to 8 years to complete their degree as a result of having to struggle with food insecurity. So it prolongs their ability to be able to achieve their college education. And we know that it really has an impact, especially for Latino kids, to be able to sustain their time in a college setting.
Thank you. We have another question there.
Buenas tardes.
Buenas.
My name's Daniel Garza. I'm with Center Forward, and I had a question about dietary supplements. There's been some great conversation up here today, but it's often something that gets left out of this topic, particularly in a Hispanic context. And I was just wondering if you saw a role for them within your organizations or the administration, if there was any momentum to get it into SNAP or WIC or anything like that.
We believe in actually having access to whole foods and to fresh produce and vegetables, and to educate people about the types of meals that they're able to make with those foods, and to have well-balanced diets. I think in terms of the dietary supplements, we only use protein bars in times of natural disaster, but not as a mechanism to really ensure the full nutrition value for all of the families. Kids, the WIC program is designed to ensure that kids are getting the nutrients they need 0 to 6, and then SNAP is there to make sure that people are able to shop with dignity for the food that they want to be able to access and have, and that, helping them to understand that these are the ways in which you're able to achieve that nutrition balance.
I did want to, I agree, and I think I wanted to uplift the Dietary Guidelines for Americans. So this is the committee that helps inform nutrition policies and programs. They are meeting, and so it's an opportunity for you to provide any comments on the importance of nutrition for the Latino community. But just to build on what Monica mentioned, increasing access to fruits and vegetables, there's been research showing that various incentive programs lead to more families increasing their intake of fresh fruits and vegetables when they have access to it, which is why our programs are so critical to improving overall health outcomes. And then just to piggyback on the college hunger situation, beginning July 1st, the exemptions that were in place during COVID that allowed college students to sign up for SNAP will begin to unwind. So we've been working with our agencies for more than a year to prepare for this, and this is in response to the federal public health emergency. We have a network of higher ed institutions. We actually worked with the Department of Education to release guidance on what this means, but I just wanted to make you all aware about that. And I remember one story I share about college and food insecurity. I remember when I went to Cal for undergrad, and my financial aid check was delayed by like a month. My dad had just got laid off from work. My mom was not working. My sisters were in college also, first generation, and I just didn't have food. And I would always talk to the custodians. I always talk to them because I have family members that work, that are custodians. I told them what was going on. It just came up. And the next day I saw them, and they brought me 2 bags of groceries with eggs and bread. And I think it's an experience that I will never forget. But I think it's such a critical population, and we've been working to continue to raise awareness and amplify our suite of nutrition programs across the country that they may be eligible for, and key partners that are out there to support students in need at this time.
Thank you. Thank you. We don't have more time for questions, but I'm going to ask our speakers or panelists to do some last closing comments or remarks. Dr. Bella?
Yeah, so I think, the thrust of my work is really around strengthening the existing infrastructure of our food system. And I think we really need to come a lot further to make sure that there are grocery stores nearby, there are farmers markets, right? And these programs are so critical to make it affordable and also to serve in times of need, right? The food pantries have been so essential. And so we really need, when we're talking about how do we make food available and accessible, it's not just the program, but it's the mechanisms that get us there that also need to be looked at. So it is the policy and it is the implementation of building the infrastructure locally in neighborhoods and communities that get it there.
Yeah, for the Latino community to thrive and prosper, we must be well nourished. And I think that, our U.S. military got that. They're the ones who established the school meals program, in case you're not aware. And it was actually because recruits were coming to the door malnourished, not prepared to serve their country. Obesity rates prevent kids from serving in the U.S. military. So it is a matter of national security. It is a matter of us being able to thrive as a community, to be able to pursue the kinds of opportunities we want to pursue, whether it's a college education, whether it's to go on to technical training, whether it's to be a social entrepreneur. Food insecurity just has a tremendous impact on our community in terms of how we thrive, our health, our ability to think, our cognitive abilities. It has tremendous impact on the development of children. So I think for all of us here today, it's critically important that we find ways to be advocates in ending food insecurity in the Latino community.
Yeah, and I would just add that, at FNS, equity is front and center, and, I'd love to stay in touch with all of you if you want to learn more about our programs or want us to speak to your networks or learn more about the work we're doing to connect nutrition and health. We welcome it. Our door is open. We want to make sure we reach, our key leaders in the community to talk about our programs and how they impact health, but also what are ways we can work together really to achieve the goals that we're all committed to doing to improve Latino health and ensure that Latino kids thrive in our country.
Thank you to our panelists. Thank you to all of you for being here today. In closing, I encourage you to use your voice, to use the access to you have, and to push for policy and program changes. Our panelists have shared some of the programs that are in place. We do know that the role community-based organizations, promotores de salud, trusted messengers played around the country are critical. Equally important are the tremendous role food banks and food pantries are playing, but also the role that each of us played in bringing change. Thank you, Alberto, for sharing that beautiful story of the custodians bringing food. And that was someone who really listened and took matters into their own and fed our Alberto. And look at what a wonderful human being he has turned in. So thank you. Thank you, Monica. Thank you, Dr. Bella. And thank you, Alberto.